How does carer support fit into all of this?
So I think it's remembering carer support can be allocated to support the full-time caregiver of somebody who has a disability or who has autism. So it's to allow that person to re-energise, to have the breaks, because we understand the importance of having a parent, a full-time carer to support somebody with autism. You don't keep them strong, then it's going to impact on the child. So the whole idea of carer support is to enable a full-time caregiver to get regular breaks so that they can continue to be the full-time caregiver, to provide the support that the individual needs.
What about for some families who don't live with their mum and dad but go and stay with mum or go and stay with dad? Do those families get any support?
So you're talking about people who might be in 50-50 shared care?
Yeah, mostly.
Yeah.
That's the one that I get the most questions around.
So if you look at it, those parents are actually getting natural breaks because they're having half a week without the child, half a week with the child. So they're getting those regular breaks. Carer support enables regular breaks. So it kind of, these people are getting it already. So we would likely not be putting in carer support in that situation. But again, every situation is different.
Yeah. So taking that a step further, we understood from our conversation with Explore that Lifelinks need to do that referral. So if they're not going to get carer support, do they need to still be with Lifelinks?
Lifelinks provides or allocates more than carer support.
Okay, cool.
So their involvement with Explore is usually around behavioural issues. So yes, they would need to be involved with Lifelinks in order to get that referral through to Explore. But Explore, and you would have talked to them, provide a whole lot more services than just the behaviour support for children. So
totally.
They do a lot of supports for parents as well. So.
But we heard from them saying that you're the ones that make that referral. So I just wanted to clarify that.
Yeah.
Cool.
What can I do if I run out of carer support days before my allocation rolls over? Can I get more?
So clearly, if you've run out, there's possibly a change in need. So if there is a change in support need, then have that discussion with your coordinator at Lifelinks. Yes, we have allocated more, and there have been occasions when we have said no, we can't allocate because the disability support needs haven't changed. So yeah, carer support is an allocation that you can use flexibly over time, and it's usually allocated for a 12-month period. So we would think that you would be able to pace out your usage of carer support so it lasts the 12 months.
Yes.
What happens if in the telling of the story or what your needs are, what support that you need, you haven't actually been completely truthful, you haven't said everything, but you've swept your concerns under the carpet? It then all falls apart, doesn't it, when you then get your allocation and it's not as much as actually what you really require. Can that be changed from that point of view, just with a conversation with your coordinator?
Yeah, look, the conversations are important, and the conversations can happen at any stage during that coordination period. So yes, if they haven't been fully open with us, we can understand that. It's not always easy to tell your story to a complete stranger who's sitting in front of you at day one. However, as you become more relaxed and trusting in the person that you're working with at Lifelinks, then you might be inclined to be more open. And once that becomes known to us, then we would review the situation.
So it comes under a review, really.
Yeah, and a review can happen at any time. It doesn't have to happen at 12-month period,
Yeah.
Things change.
It does.
Yeah.
Is the carer support payment taxed? I want to ask my mum to provide care for my child, but she's worried about her benefit being affected.
No, it's not taxed. It is a form of reimbursement, so it should not affect anybody's benefits.
And if it does? Or if there is concern, who should I ask? Who should the parents ask?
Well, they could always come back to the coordinator. who will then make direct contact with the Carer Support Payment Office and get clarity. But yeah, our understanding is it is not taxed.
Maybe have a discussion with Work and Income if you feel that it is affecting any payments that you're receiving.
What is the difference between carer support respite and individualised funding respite?
So carer support is a form of reimbursement, either a half day or a whole day, whereas individualised funding respite, if you choose to use that for a support worker, to pay a support worker, it is a taxable form of income.
Right. I understand you can use carer support days flexibly now to purchase items that help your child. Can you explain a bit more about that?
Yeah, well, let's take a trampoline for example.
Mhm.
So the way the parent is getting a break is that the child is occupied safely on a trampoline. So some families have purchased a trampoline as using their carer support, remembering that that is how they get their break. All right, so it's because that money has been used there, they no longer have the ability to take more breaks throughout the year. It's a choice that families make. The flexibility is absolutely brilliant, but they need to remember also that carer support is there for a 12-month period, and unless the disability support needs change of a person, it will not be increased.